Whether stress is mild in nature or diagnosed clinically as an acute stress disorder or post-traumatic stress disorder, the negative consequences and symptoms can be life-changing. The causes are numerous, and common causes of trauma that cause acute stress disorder are motor vehicle accidents, witnessing a mass shooting, and industrial accidents. And just think of all the daily causes of normal stressors that are cumulative, like our personal relationships, finances, and career stressors. Then we have the compounding effects and co-occurring issues like substance use disorder, anxiety-related disorders, and insomnia, to name a few. Very quickly, you can see how complicated the topic of stress becomes. Generally, we think of stress as those common, daily, incessant issues. We tend to internalize, not communicate, and hide these concerns from our loved ones or our healthcare providers. Hopefully, after our short presentation, you will be better equipped to help yourself, your loved ones, and those you work with, and to protect one another from the beast of stress. If you think you or someone you know has clinical acute stress or PTSD, then first and foremost talk to your doctor. If you ever feel suicidal or think about self-harm, don't take it upon yourself to carry those burdens, but share them with a healthcare professional. This conversation is intended for bettering our self-care, not as sole treatment for severe symptoms. The value of eating well and moving our bodies should not be forgotten. Find an activity you can tolerate or even enjoy, and you will find that becoming stronger will make you mentally stronger. You don't have to be good at it, and chances are that others around you aren't confident of their skills either. We even have evidence that strength training prevents chronic disease and lowers overall death risk more than aerobic exercise alone. It helps guard against the naturally occurring muscle loss with age. Loading the bone helps bone strength and density, guarding against osteoporosis, especially for aging women. So I'm here with Priscilla Wicht, and she is our benefits coordinator. And we thought we should have an important conversation with her about resources for employees and their families. My first question is, what is EAP?
The EAP stands for Employee Assistance Program, and this offers a free benefit for our employees and their families.
So my second question is then, how do we access EAP or use it? Do we need a referral, a note? Is it just a phone call? But how do they actually use it?
The EAP is very easy to access. You can call the 1-800 number, you can log online, there's an easy to use app you can download, and our employees do not need a referral at all. They can call, access them anytime, 24 hours a day, 7 days a week.
So are there any common misconceptions about EAP, or do you find that people don't know what it's used for?
Common misconceptions about the EAP: most of our employees may think that it's for the severely anxiety-driven, stressed out employees. However, it's there for everybody. There's several life tools that are available online. There's recipes, there's just things to help parenting, everyday stressors it's there to help with.
So Priscilla, you mentioned the recipes and the help with the parenting and just helping with stress. Is there an easy way to access this? And can we do it by more than just phone? What would you recommend us doing?
I recommend accessing the EAP through calling them directly. Of course, when you're in a crisis, I feel like that's the fastest mode to get a hold of them. But for those everyday tools, there's a handy app that I like to access that allows me tools to webinars and all kinds of things that just help me on a daily basis.
So thank you, Priscilla, for all the helpful information. And we have the EAP flyer with directions that we will attach to the email for the employees.